And what that does is it basically gets more lidocaine into the lips because these products have lidocaine in them. So then it numbs up a little bit more. And then when I can go back into it, it'll be more comfortable for her. Any pain?
No.
Feels a little pinching, or how does it feel like?
Like a tiny little pinch.
Okay.
I barely feel it.
Okay. And again, there's no dental block. You don't need to really block the whole face just to do the lips. With a little bit of topical and good gentle technique, you can get this done with very little discomfort. You obviously feel it, but it's not horrifically painful. I know a lot of people are just scared of lip injections. They look painful putting a needle on the lip, but it's really not that bad. It's just gentle, gentle. You can see there's no jabbing. It's very smooth. Once I go across, I'm gonna just smooth it out, make sure there's no lumps or bumps or anything. Now, to get a little bit more of the heart shape, I'm going to go a little bit more to the border. And rolls it down a little bit more. Gives us more lip show, if you will. Border is more painful, but she still seems to be doing okay.
Mm-hmm.
There's no bruises, tiny little bleeding spots which stop. Takes it a few seconds for those to stop, but basically, by the time she goes wherever she's going, most of that should be done. Now you saw her cringe a little bit at the top lip, Vermilion. That's the most sensitive area, especially when you get close to the central part. You can look at a patient's eyes and see how they feel. You want to take that into account. If they need a break, give them a break. You gotta know how they're feeling. I know this hurts more. So we're just gonna go a little bit slower. This is the most painful right there at the Cupid's bow because there's innervation or nerves coming from both sides. Now, ideally, if you look at lips, leave your mouth open just a little. The central tubercle right here should be fuller, and then the lower lip, the lateral tubercle should be fuller. But most patients today want a little bit more of that modern voluptuous look, which is slightly fuller throughout. And you can see a variety of techniques. I did the serial threading. I went across the wet lip, wet dry border. I did the red lip. I did the vermilion. And all of that I'm still only used half a cc. So I'm just going to distributing it nicely to get our nice results. You don't want to just pump a whole bunch of it into quickly into one spot. By now, it should be even more comfortable. Do you feel any of this now? Okay, so the Juvederm has lidocaine in it, and as you inject, the lidocaine gets absorbed into the lip and gets a little bit more comfortable. So leave your lips open for me a little bit more. A little bit more to the lower lip. Now, a couple of facts. When younger patients come for lip injections, they want to go full. When older patients come, they're very afraid of going full. It's just one of those things. Lip injections always scare people because we've always seen that fishy, ducky looking person at the supermarket, or the cousin or the friend who had their lips done poorly and they ended up looking